I am Sean Webb, and this is Your Superior Self.
Hi, this is Zach Poitras, and this is Your Superior Self.
I'm Andy Mant, and this is Your Superior Self.
Hi, this is Sue Jackson, and this is Your Superior Self.
I'm Ginny Sarasvati, and this is Your Superior Self.
What's up, everybody? I'm Aubrey Marcus, and this is Your Superior Self.
What is up, Superior Nation? Welcome back to Your Superior Self. I am Trey Downs, and I've been sitting on this episode. I wanted to air it right before school because I'm hoping that this helps parents, and I hope that some of the teachers listen to this, maybe some schools, I don't know. But I have Dr. Jeff Gusky on the show, and we have an amazing conversation about COVID and its relationship to humidity and how absolute humidity can help us understand our bodies and the moisture in the air. Now, essentially, the way that I understand it is the more moisture that is in the air, the better, because it keeps your mucus more moist, and which in turn catches more of the bacteria, more of the virus stuff that is floating around on surfaces or whatever. So essentially, growing up, my mom would always put a humidifier in our rooms when we were sick, and I didn't understand. I didn't know. I was like, okay. And actually, it's a good thing. You should be doing that. If you don't have a humidifier, you should go out and get one right now. A lot of the new HVAC systems have humidifiers built into them. Put that up to like 55%, 50 to 60% humidity, because the more moisture in the air, the better. And again, it keeps your mucus, which is your defense system against viruses and bacteria, more wet. And the wetter that it is, it catches a lot more of the bacteria. It is your Kevlar. It is your defense system. And the more dry that it is, the worse. The more dry means that you are more susceptible to infectious viruses, COVID, the flu, and this is all information, this is all data that has been collected and produced over the years. And I don't know why more people are not talking about this. Maybe they don't want us to know. I don't know. But outdoors is not where you're going to catch COVID. It's going to be indoors. And Dr. Jeff Gusky goes into the research and explains it and gives examples of places around the world that show this information, that show this data. And I will post some links in the show notes so that you guys can go to some of these resources that are legit, that are science-backed, that are important information that you need to read up on before your kids, well, I guess when this airs, your kids are going to school, but before the fall, before this flu season hits, a lot of people are going to get the flu, and they're not going to know the difference if it's, I don't know. Maybe they're going to confuse it between the flu or COVID. However, I know, I can feel it in my bones that the COVID numbers are going to spike in the fall and in the winter. And if I can put this out there and some of you guys listen to it and understand how to prevent that, then that's good. That's something that I want to happen. I know that I've gotten humidifiers in my house, and we're going to use them and utilize them for sure in the fall season and in flu season, so that way we can make sure we prepare ourselves and increase the security of our immune systems. And Jeff Gusky, man, he's a character. He's all about this. He is all about getting out there and voicing his mission and helping others. And for those that do not know who he is, he's a National Geographic photographer. He's an ER doctor. He's an explorer and professional speaker. And just going off his bio, which is phenomenal. His life changed in 1995 when he found an obscure remnant of the Nazi concentration camp. I guess I'm saying this correct. Plasso. Maybe I'm not. But that's how I pronounce it. Where the story of Schindler's List actually took place. And since then, Jeff has walked the grounds where millions of people have been slaughtered in modern times. And he has, it affects him. He takes this mission personally. He tries to get out there and help others. That is his mission. And he believes in the modern societies around the globe are now experiencing a human emergency caused by rapidly accelerating dehumanization, which leads to addiction to modern life. And I could not agree more with that statement. But he has data-backed information. He has legit cases. He has information that I need to share with you guys that I don't know enough about COVID to speak about it. That's why I have him on here. He's a board certified emergency physician, and now he's on the front lines, and he's trying to get the word out about the relationship between humidity and COVID. And that's why I'm so excited to have him on here, so he can speak to that, and hopefully this can help others be more prepared for flu season. And this conversation goes pretty deep on a lot of different subjects. We talk about his mission and being an explorer and finding artifacts and the history behind the world. And this is just a little clip of that.
And there's something else that troubles me deeply. And I was the first fine art photographer to go behind the former Iron Curtain and document a hidden world of the Holocaust just after the fall of the Berlin Wall. I've personally walked the ground in remote corners of Europe and the former Soviet Union, where millions of people have been murdered in modern times. I told the audience today at the African American Church that this is personal for me. I still find bones of people murdered lying on the ground sometimes. That's a bad day. The bones may be decades old, but that happened in modern times. And there's a formula that has been used over and over and over again by tyrants everywhere in the last 125 years that sets countries on fire, transforms civilized nations into weapons of mass destruction using mass media. And that formula is what we're seeing right now.
Yeah, and that part of the conversation actually happens towards the end of the interview, and it's very powerful because it makes sense to what his point is. And I just want to say thank you to Dr. Jeff Gusky for coming on the show and really sharing his passion with us and educating me for sure. I mean, the research that he presents makes sense to me, and I hope that it can help prevent mass outbreaks of COVID in the fall and in the early winter, and even in late winter, whatever, forever, just hopefully we can, until we can get a vaccine that is safe enough to take, we can do these things to help prevent further outbreaks and hopefully strengthen our immune systems. That way we can defend ourselves against viruses and bacteria that are trying to attack our body. And yeah, it's going to be a pretty powerful one. And I wanted to put this out I should have put this out like a week ago before school, but if your kid's going back to school, please make sure you guys get humidifiers for their rooms. Make sure you guys are hydrating, because if you're going back into the school system, everyone knows that the kids, I've never been more sick in my life until I had kids and they went to school. And then I just remember like being single, not getting sick. I could, go out drinking for months and never get sick. And then I have one kid and put him in kindergarten or preschool, and the first week in preschool, I'm getting every known virus to man. But yeah, definitely check out Dr. Jeff Gusky more. You can visit his website. I'll post that in the show notes so that you guys can go and follow him there and his mission. So yeah, it's going to be pretty intense. But before we get into it, you guys can follow me on social media, Instagram, tdowns80, on Twitter at downstrey. Go to my website, yoursuperiorself.com. Leave me a message. Let me know what you guys are thinking. Let me know what you think about this COVID and humidity. I would love to hear your feedback and your takes on it as well. So before we get started, I just want to say I wish you guys good luck this school season. Hopefully hopefully we can get a handle and keep our kids safe this fall. If you guys are going in person, please take the precautions and help our kids stay safe and yourself as well. So without further ado, here is my conversation with Dr. Jeff Gusky.
Hi, this is Dr. Jeff Gusky on Your Superior Self with Trey Downs.
Jeff, how are you?
I'm delighted to be with you, and it's a fascinating time to be alive. Right, but on a big edge.
Oh yeah, absolutely. So why don't you give everyone a quick, give them some background on yourself and what you're up to today, because I know you're busy.
I am a practicing emergency physician, National Geographic photographer, and explorer. And I'm now very focused on COVID and bringing a solution that can literally save us from hotspots. And it's something that has been right under our nose, and the experts are missing it. It's old data, and it could just change the morale of the country.
What is so? We'll dive into that real quick. So
Okay.
What is that?
So the missing link has to do with invisible danger in the air we breathe indoors. So we are dealing with a crisis of dangerously dry indoor air, and it's all tied to weather. You remember James Carville said a couple decades ago, it's the economy, stupid.
Mm-hmm.
And the words of hope that should be on the tip of all of our tongues in the COVID crisis is, it's the weather, stupid, because COVID hotspots and the pandemic are entirely weather related.
Mm-hmm.
And they're not talking about it. And so just as a baseline, there are hundreds of millions of people and entire nations that never flattened the curve because they never had a curve. And I'll give you some examples. I put this together for a presentation I gave earlier today. This data is accurate through last night. So Japan, 126 million people, they have a death rate of 8 per million, as opposed to New York City, which is nearly 2,600 per million. Indonesia, 273 million people, a death rate of 9 per million. Thailand, 70 million people. They've had 58 deaths since the COVID crisis began. If we were to extrapolate that to the United States, we would have 274 deaths total instead of 124,000 for America. It's just startling. And the really great contrast to understand the difference between New York City and these other places is Hong Kong, because New York and Hong Kong are approximately the same number of people in about the same size landmass. New York City, nearly 2,600 deaths per million. Hong Kong, as of last night, has had 6 deaths total, not per million, but total since the beginning of the crisis. What connects all the dots on these places? It's weather. So all these places have what's called high absolute humidity. Now, absolute humidity is key to understanding COVID. It has nothing to do with the humidity that we hear about on the weather report, which is relative humidity. Have you ever heard of absolute humidity before?
No,
I never
I have not. I've never heard of it.
So there's a really cool 60-second science podcast by Scientific American called Humidity Helps Fight Flu from 2009. And in 60 seconds, your audience will understand that we've known for 11 years that we've been looking at the wrong thing to understand the airborne spread of viral disease. So absolute humidity is the amount of water in the air, regardless of temperature. And it turns out that when that number is above 10 grams per meter cubed, just remember the number 10, you essentially don't have hotspots. When it's below that is when you get into trouble. Now, another point that's very, very important is that COVID hotspots and the pandemic does not happen outdoors. The characteristics, the physics of outdoor air are completely different than indoor air. They're not telling us this. You know, we've been asked to do social distancing, one size fits all. It's not scientific.
Mm-hmm.
In outdoor air, you probably don't need it. And the evidence of that is just coming out in the last several days from the very carefully tracked numbers in New York City, where they do a lot of testing and a lot of tracing, and with all the recent riots in the street, no social distancing, no masks, they've had no increase in COVID from those events. So it's all about indoor air. And what happens with these hotspots is very simple once you understand. In fact, look at Sweden versus Finland. This is the classic example. They both have air that's dangerously dry 8 months out of the year. That they're at levels of Wuhan in December or worse in terms of the absolute humidity. And in Finland, they quarantined. In Sweden, they had only a limited or moderate quarantine, and people could still go to restaurants and go out. And so where you get a hotspot is where somebody with COVID goes into an enclosed space, like a public building, packed with people, and breathing dangerously dry indoor air. And how we know when it's dangerously dry is because this absolute humidity number predicts the quality of the air indoors. So they can tell you what that number is at any given time outdoors. And you can know that outdoors correlates with indoors. And when it's in the danger zone, that's when COVID bombs go off. So one last point about this, Wuhan is fascinating because it shows us how confusing the relative humidity number that we're all so used to is when it comes to COVID. So when you look at a chart of Wuhan, it looks like Florida. It looks tropical, 12 months a year. It's between 75 and 80% year round. But when you look at the absolute humidity, in December when the bomb went off, the indoor air was bone dry. Bone dry. And that is what causes COVID to explode. So if somebody with COVID goes into a nightclub or a restaurant or a mall that's packed with people, and the indoor air is humid in the range of humidity of 50 to 60%, which would equate to an absolute humidity above 10, you're not going to get hot spots. Okay, so that's one piece of information. The next, am I giving you more than you want to know, or?
No, I'm interested in it.
Okay.
I've never heard of this theory.
It's not a theory. In
No?
fact, let me share with you another piece of information that I shared today in this presentation. This data has been around for years. And it's not in dispute. There are many studies that say the same thing. So I'm looking at a research study from 2009. And in the summary section, I'm going to just read a sentence or two.
Go ahead.
It says, these findings also suggest that humidification of indoor air, particularly in places where transmission to those at high risk for complications, such as nursing homes, may help decrease the spread and toll of influenza during influenza season. Trey, this is not even in question. They have known about this for so long. And then all the studies after Wuhan are saying the same thing, that when you have dangerously dry indoor air and high density of people packed into an indoor space, that's when you get COVID going off like a bomb.
So when did you come across, like when did the light bulb go off for you about this?
6 years ago.
Mm-hmm.
I'm sitting across. So here's the backstory. I'm fortunate to be part of an exhibition currently showing at the Smithsonian National Museum of African American History and Culture related to World War I. And so I was doing media, television, radio, out going across the country, and then COVID hit. And I felt like I needed to switch gears because I knew something from 6 years ago related to a different outbreak, which happened in Dallas, where I'm located. It was the Ebola outbreak in 2014. And about a month after the outbreak, I'm sitting at a family dinner across the table from my best friend's brother, who is this genius electrical engineer that designs indoor air sensors for hospitals. At that time, he owned a company that installed them all over the world, and he received millions of data points of indoor air quality from all over every day. And he said, Jeff, on the 2 days when the nurses got infected, they were 2 sequential days. They were red days. And I said, Rick, what in the heck is a red day? I've never heard of that in medicine before. And he said, oh, well, it was that the indoor air inside the hospital was dangerously dry. And the physics of air inside a closed space, when it's super dry, favor airborne transmission of viruses. So viruses can go all the way across a room, and they can last for hours. And when the humidity is high, not super high, but in this moderate range of 50 to 60%, which is about 10, 11 grams per meter cubed in absolute humidity, the viruses don't last as long, don't go very far. The viruses on surfaces don't dry out so much, get into the air and into your lungs. And the most important thing, which people are not talking about, and I have a feeling that it's going to turn out to be the key to all of this. It has to do with human susceptibility. So we have a natural protective barrier against viruses, which I call Kevlar against COVID. It starts at the tip of our nose and mouth and goes all the way deep into our lungs. What's on mucous membranes? Mucus is like a Kevlar vest. It almost bulletproofs us against viruses, but it only works when it's moist. The other thing about mucus is that there are about 300 genes, according to a preeminent Yale scientist who is publishing on this, that get activated and produce interferon that attacks the virus when the mucus is moist. And for reasons that are not fully understood, it doesn't work when it's dry. And then there's a third piece, and there are probably others, but the third piece is that we have what are called cilia, which are like a conveyor belt that carries viral particles from deep in our lungs out to the surface, and we expel them. So all of that works when the mucus is moist, doesn't work when it's dry. And so when you look at the places where the worst losses have occurred, nursing homes, prisons, meatpacking plants, cruise ships, All of them meet three criteria: high population density indoors, virus, and dangerously dry indoor air. When you look at Arizona right now, you can look at a map of the entire United States and see the real-time readouts of absolute humidity, and it looks like it's flashing red. It's so predictable. Over 2.5 months ago, I wrote to a TV reporter right after he did an interview with me in Phoenix, and I told him that Phoenix, I believe, is the most at-risk large American city in the United States. And he thought I was crazy.
Yeah, look at it now.
And they still don't understand why. So it's simply this. You could be in the Mojave Desert. You can be anywhere in Arizona and make the indoor air look like Hong Kong or India or Thailand or Taiwan, for example, that has almost 24 million people. They've had 7 deaths total since the beginning. Bangladesh, 164 million people. Their death rate is amongst the lowest in the world. I can go on and on and on. There are just so many examples that it's the weather behind COVID. And because of that, it's predictable and preventable. Can you imagine?
Like, explain that though. Like,
okay, so the absolute humidity can be predicted by weather services. It's not something we can measure easily at home, but they can. And they can, in fact, I have a new vital sign of viral safety that I'm hoping will, in the not too distant future, be on every weather report every day, around the clock, around the world. It's called the Viral Safety Index. It's both a call to action and a plan to keep us safe. When it's red, we humidify and hydrate. When it's green, we all breathe easier. So what it tells us is when the absolute humidity outdoors is dipping down into, let's say, around 12, and then you factor in the difference outdoors to indoors, which comes from air conditioning or heating, because those both will draw the water down a little bit. And then you just stay on alert to keep your indoor air humid between 50 and 60% relative humidity around the clock when the viral safety index is red. And then when you go outdoors, you hydrate. You drink some Gatorade. You stay hydrated, because that helps you carry around portable humidity, if you will, in your respiratory tract.
gets that mucus wet, right?
I'm sorry?
It gets that mucus wet, so that way it can catch the bacteria.
Yeah. Okay, here's an example that everyone can relate to. You know how you go up in an airplane, people often get sick?
Yeah.
You've heard that before. It's happened to me a lot, and I travel a lot. And the reason is very interesting. When you're up at altitude, the humidity, relative humidity, is about 10%, can go down to 5%. The absolute humidity can go into the 2s. Wuhan was at 6 when the viral bomb went off. What happens without us realizing it is that the mucus dries out and cracks. Now, are you getting infected on the plane? I don't think so. And this is an example of us being in the fog of war right now, because there's more that we don't know than we do. But one thing I can tell you with pretty good certainty is that being inside an airplane, a pressurized aircraft, may be one of the safest places you can be against COVID. To my knowledge, there's not one documented case where you have a cluster occurring inside an aircraft after a person with COVID gets on board and flies across the ocean or wherever. You know, we had plenty of people coming out of Wuhan and then people coming out of Milan and France, you know, to the United States before we limited the travel. And I saw an article about 10 days, 2 weeks ago about 400 or so examples where the government officials did contact tracing of airline flights which had an infected person, and no one, to my knowledge, knows of a cluster occurring after a person with COVID flies on an airplane with other people. So why is that? And why do we still get sick? So I believe it's because of two principal things. There's a high amount of air replacement in an airplane cockpit. Every 2 to 3 minutes, the air is exchanged and it's flowing. We don't see it. COVID is about it's about making invisible danger visible. It's also about making invisible safety visible. And inside aircraft, you have invisible safety from airflow and also from HEPA filters, which is high efficiency particle filters that filter viruses better than an N100 mask. It's amazing. So what I think happens, the reason why I believe we get infected on airplanes is that our mucus dries out. We get off the plane, go out into the terminal or out of the terminal, and our mucus is impaired, at least for a while. We don't know it. And we breathe stuff.
Yeah.
That I think that's it. So for people that are flying, hydrate. And how do you know that you're hydrating enough? You're having to get up and go to the bathroom
All the time.
Not all the well, you don't have to overdo it. You don't want to drink, if it's water, you don't want to drink too much water because, you know, sometimes with medicine, when we give ideas or suggestions, people think, well, if a little is good, a lot is better. And you can actually develop water intoxication, which is a serious problem. So you just want to hydrate enough that you're peeing at a normal rate, or take Gatorade and you can drink all you want. You're not going to get into trouble.
So how busy have you been? I mean, you're going around speaking to everyone, right?
I'm working on this night and day, 7 days a week, and I'm worried. And I'll tell you why. This is another thing they're not telling us. And it's very serious. I believe that and I'm not exaggerating, I'm not trying to spread fear, but I believe that we are looking at an apocalyptic situation come flu season, which starts end of September. If we don't correct very quickly our vulnerability to dangerously dry indoor air. And let me explain how all this fits together.
Sure.
So you remember when they shut down the country, it was because of fears of mass death, like millions of people, and a catastrophic collapse of the healthcare system. What happened? No mass deaths and no catastrophic collapse. The Javits Center, the comfort ship, these emergency hospitals set up all over the country, largely went unused. The ventilator crisis, for which we went into overdrive didn't turn out to be a crisis. And no one has talked to us about why. Why did the hospitals empty out? Why did the apocalypse not happen? Have you heard anyone talking about why?
No.
Well, it's the weather, stupid. I'm not calling you stupid, Trey. To our leaders, it's the weather, stupid. COVID hit America at the end of winter. And very soon after it hit, the dry days of winter were replaced with the moisture days of spring, which I call green days. humid days. And it turns out that spring weather is a powerful antiviral. That's why Taiwan has only 7 deaths since the beginning. That's why Hong Kong has 6 deaths. That's why Japan has a death rate of 8 per million, and on and on and on. Thailand, a death rate of, not a rate, but 58 deaths in a country of 70 million people. If you extrapolate that number to America, through yesterday, we would have had 274 deaths total for our whole country based on our current population.
Jeez.
It's the weather, stupid. And so when you go from winter to spring, you have the benefit of this antiviral outdoor air that is making the indoor air we breathe safer. And so the rates of infection go down. And then as spring turns to summer, we have red or green days turning into green weeks. But there's one problem, which the leaders still don't know about, because the scientists and the doctors who are advising the White House aren't telling them, apparently. I mean, that's the only thing I can figure out, because the data has been there a long time. And that is that hotspots only occur in dangerously dry indoor air. So here's a perfect example. In fact, I wrote on June 11th to the chairman of the governor's task force, or actually it's called the Governor's Strike Force to Reopen Texas. He's a neighbor of a friend of mine, lives about 5 minutes from where I am right now. And he is the most powerful man in Texas with regard to reopening the economy. And I said, Mr. So-and-so, I won't mention his name. 2 days ago, the weather system came in. No one knew it, no one felt it, no one saw it, because the danger is invisible. And using this special instrument that I have, which measures absolute humidity, I was able to determine that in a matter of hours, the Texas weather dropped below Wuhan. It was 3.9. Wuhan was 6 in December when the bomb went off. Or in relative humidity terms, which are just a rough approximation, it was 13.5% outdoors in Texas in June, almost at summer. So the point is that even in places that are generally humid months, humid places, you can have a weather system that will turn everything upside down when you least expect it. It can happen in the middle of the night. I believe that's what happened in Washington State when that first nursing home got hit just outside Seattle. I think it was a weather system in the middle of the night, and all it takes is a number of hours of dangerously dry indoor air, and the bomb can go off, and you don't know it. And so I said to this gentleman that in about a week, a little more, we're going to have a marked rise in cases, marked panic, uncertainty, hospitalizations. And guess what's happening right now? All of that. So today, the governor apparently pulled back on the reopening of Texas. And in fact, in my view, they should have been doing the opposite. They should have been full speed ahead, because for the last at least 10 days or so, 8 days, something like that, the weather has been humid again. It's gone back to baseline. And the numbers that we're seeing in terms of hospitalizations and cases were from the dry air around the 9th, 10th, and 11th. Because it takes 8, 9, 10 days for a COVID bomb to reveal itself.
Mm-hmm. So absolute humidity. So the higher the number, the worse it is. Is that what it?
The better.
The better. So
what you want is when the indoor absolute humidity about 10.5 or above, you're good. You're not going to have hot spots. And what's really cool is that I made a discovery. So actually made several discoveries by accident. And this is very hopeful. So I'm on the radio. It's about a month, 5 weeks ago, something like that, in Cincinnati, telling about indoor humidity.
Mm-hmm.
And I get a call right after the show. And it turned out to be the president of the Cincinnati Fraternal Order of Police, the police union, 1,000 members. He said, "Doc, this is the most hopeful, most sensible information I've heard yet. And by the way, in the Hamilton County Jail, which is one of the largest jails in the country, in a state, Ohio, which has the highest rate of COVID infections in any correctional system in the country. The Hamilton County Jail has 0 COVID cases." So he said, "I heard you say that it's an indoor problem and that it's happening in nursing homes and prisons." And so that got my attention. And so he hangs up and then he calls me back. He called the sheriff, Sheriff Jim Neal, who's a wonderful guy, said, "Sheriff Neal, what's your humidity?" Sheriff Neal said, "I don't know." And the sheriff calls the engineer for this large jail and then calls Dan Hills back, the president of FOP, and he says, "It's 52%. What does that mean?" It was in the green area, in the safe zone, and they didn't know it. And they still have 0 COVID cases. So I go up to Cincinnati for a press conference because we wanted to announce this to the country. And on the way, I'm leaving DFW Airport, Terminal C. I don't know if you've ever been to DFW. Massive space under roof. You have, I think, 5 or 6 terminals, and it's the size of a city, a fairly big city, and or at least a moderate-sized city, all under roof. And I had my device with me in my backpack, and lo and behold, the indoor air inside DFW was better than the Cincinnati jail. It was super safe. And then I land in Cincinnati and measure the indoor air at Cincinnati Airport, and it was Wuhan in December. Amazing, a tale of 2 cities.
That is amazing.
Yeah, so then I go to Love Field, which is another large airport in Dallas, and their air is the same as DFW. And then I find out about a jail, large jail north of Dallas, 1,300 bed capacity, 0 COVID cases. And I got permission to go inside, and their humidity is better than Cincinnati. It's even better than DFW Airport. It's tropical. It was perfect. They've since had 1 case on the 17th, and three guards and 1 inmate. Wasn't an outbreak, still isn't. And my sense is that they were outdoors on the 9th or 10th, maybe going to a court appearance or something, in a vehicle. And that's where that happened. But they, in essence, they still have 0 cases in terms of outbreaks, while Texas is lighting up in the prisons and jails. And then I checked North Park Mall and Redbird Mall. They were all in the safe zone at 11. So it turns out that I believe this is related to the fact that this is old data, and the engineering companies that manufacture the HVAC systems for large buildings have known about this, and they just dial in the setting for safety indoors. And so none of these places are going to have hot spots. They're and imagine if we did that, like if the governor of Texas, and this is what I'm trying to make happen, calls upon every nursing home, every prison, every hospital, every meatpacking plant, every school, every mall, to have green indoor air. What does that do to society? Very quickly, it enables us to reopen the economy and not have hotspots. It's not a cure. We will still have occasional transmission person to person, but you're not going to have the COVID bombs go off that are scaring everyone to death and demoralizing the country.
Sure. No, it's crazy. I just saw something today that I think it's in New Jersey or New York where people are traveling through their states. They're told they have to self quarantine for 14 days. Because of the
Yeah.
hotspots are starting back
They
up.
don't understand. They don't understand what's causing the problem. It's a person with virus is one of the three requirements. If that person doesn't go into an indoor space packed with people, you're not going to get a hotspot. If that person goes into that space and the air is green, like DFW Airport or Cincinnati Jail, you're not going to have hotspots.
Well, where can I get this meter like that you have? Is it you only have the only one?
No, you can buy them. They're about, I lucked out. I found one on eBay the meter is about $700.
Jeez. I need to make one.
The sensor is another, depending on which one, it's either like $350 to $700 or 800, something like that. So you need both. So what I have is about a $1,600 price tag, and I got it used, and it works.
It's worth every cent.
It's amazing because it gives you real-time situational awareness. So today, I spoke in a Black church in South Dallas because another piece of information that we're not being told is that the frighteningly high death rate in African Americans to COVID is not just because of inner city poverty. Do you want to hear about this?
Sure. Yeah.
It's also because of a genetic vulnerability to the virus. So a Black billionaire living in an exclusive gated community on a mountaintop in Colorado could be just as vulnerable as a poor person in inner city. And it has to do with several enzymes that are, one of which is higher in the tissues of people of color, in particular Blacks. And it causes not everyone, but in a certain number of African Americans that are infected, a higher rate of the terrible outcomes with COVID. And so I'm in this church, and people of faith all over the country are feeling very, very disabused because it's almost like they've been singled out not to have worship services, to have, you could go buy, liquor, but you can't go to church. It's crazy in so many places. And so I brought the device with me and measured the air, and oh my gosh, it was so safe. And the people there felt so happy to learn that the indoor space inside their church was better than DFW Airport.
Awesome.
Yeah.
When you go out and you give these talks, like what are the three basic questions that they ask you after you give your speech?
One is, why didn't we know? Why weren't we told? And I think that's going to be very, very hard for the country to grapple with. If it turns out that this is correct, and I believe it is, based on everything we can tell, and there are too many nations that have escaped COVID that are in utter poverty. Haiti is another one. If there's any place that has no significant healthcare and that can't social distance. It's Haiti. And they have among the lowest death rates in the Western Hemisphere because it's so humid. So when people realize that had we known this in February and just the nursing homes been made green with indoor air between 50 and 60, we're looking at potentially tens of thousands of lives that could have been saved. And the avoidance of shutting down most of the country, if not all the country. And we're still not being told, and that's where the danger comes, because in the fall, the Grim Reaper is waiting for us. We will not have the antiviral effects of spring weather followed by summer weather. We will have the opposite. And the danger that they predicted as the reason for shutting down the country will suddenly be at our doorstep, and very real, very risky. And I'm just gripped with a sense of foreboding. And there's something else that troubles me deeply. And I was the first fine art photographer to go behind the former Iron Curtain and document a hidden world of the Holocaust just after the fall of the Berlin Wall. I've personally walked the ground in remote corners of Europe and the former Soviet Union, where millions of people have been murdered in modern times. I told the audience today at the African American Church that this is personal for me. I still find bones of people murdered lying on the ground sometimes. That's a bad day. The bones may be decades old, but that happened in modern times. And there's a formula that has been used over and over and over again by tyrants everywhere in the last 125 years that sets countries on fire, transforms civilized nations into weapons of mass destruction using mass media. And that formula is what we're seeing right now. It's called myth amplified by media to incite rage in crowds for power. It was invented 125 years ago on the streets of Paris during a moment in French history called the Dreyfus Affair. And so why that relates to now and to COVID and to America. America has always had this ability to moderate extremes. We've had this core of a moderate middle, people of conscience that could rein in with checks and balances the dark side of human nature. And so what's happened in other countries with modern mass destruction has not happened here. These events always occur when you have a war, famine, economic, or now a pandemic, where you have such uncertainty and fear and pain and anger and exhaustion. People just want hope. They just want to feel safe. And if a human predator using mass media incites rage in crowds for power, many people will follow because they just want to feel safe. They want to feel something. They want to feel like their lives can get back to normal, and rage becomes like a drug. Now, when I say human predator, what I'm talking about is something that any person working in an ER can relate to. It has nothing to do with politics. There are people like the Harvey Weinsteins of the world that have always been with human society, always will be. They're people that have a pathologic absence of conscience. They don't hurt when they hurt other people. And they're often brilliant and cunning, well-educated. They may drive a Rolls Royce, a Harvard degree, and wear a three-piece suit. In the ER, we are responsible for confronting the dark side of human nature, confronting human predators, because if we don't, people get hurt. These are the sexual predators, the child abusers, the rapists, the murderers, the elder abusers. They're very clever and they exist. And we do not feel conflicted as ER people in confronting those dangerous people. And we do so in a very respectful way. But we rein them in and we have to report them and we treat them, with professional demeanor, but we take it very seriously. If we don't, people get hurt. Well, with political correctness in modern times, we're taught that everybody is good. There is no dark side of human nature. And if you just let your guard down and are nice to everyone and pretend that everyone is kind and everyone is going to treat each other kindly, if you just treat them kindly, that works with people of conscience. It does not work with human predators because they will eat your lunch. And the one thing that human predators crave is a society without checks and balances, because that's the only thing between them and the power that they want to accumulate. And that's what's happening now. So you may have seen when you were considering having me on the one sheet that my podcast.
Yeah, your media sheet with all the stuff on there.
Yeah, and that was written in March, and it predicted exactly what's happening now. Because when you have a society that is stressed and dealing with uncertainty and unanchored, and people are worried, and economically, they're out of work, they're hungry, that's when anarchists pounce. And I'm sure that what we saw with the tragedy of George Floyd was planned, premeditated, technology driven, extremely well funded, not accidental, and it's not an outpouring of conscience. This is anarchy. And it's what has happened in every single genocide since the Dreyfus affair, since this technique of myth amplified by media to incite rage in crowds for power was invented. The technique enables a few bad people to poison the conscience of millions using mass media and to create constituencies of rage. And so America is at a tipping point that we've never been before. And if COVID comes back with a vengeance in the fall, and right now it will, because leaders have not figured out why hotspots occur. And in the fall, hotspots will develop into massive viral bombs, because one person will infect a bunch of people, and that bunch of people will then go out into other enclosed spaces packed with people in dry air and infect another bunch of people, and that's how the bomb goes off and explodes. And we will see New York cities all over America, and we will see the collapse of the healthcare system, and we will see anarchy like we cannot imagine. What we have been through in the last month was a dress rehearsal for what's coming.
Wow. So in the OR, you see a lot of these predators, like you talk about that, like the people that are not, would you say the OR or you, excuse me, ER.
Yeah.
So the ER, you see these predators quite a bit.
They're infrequent. We don't see, so we see them. We're the ones that see them. So does law enforcement. That's why when you hear about defunding the police and turning law enforcement over to social workers are going to have a lot of effect on M13 homicidal killers. This is what predators want, is they want to demoralize. This is always how it works, is that they're very methodical in that they demoralize the society from inside out before it knows what's hit it. And so people make all these compromises like a lobster in a pot. You know, they make one compromise after another, you know, being politically correct, thinking, well, if they're just nice, more nice, that other people will be nice to them. It doesn't work that way. Predators using mass media are like the Wizard of Oz. Do you remember at the end of the Wizard of Oz when Toto pulls back the curtain and there's this short little guy pulling all the levers, talking into the megaphone and
Sure.
sounding like the all-powerful Oz? That's what predators do. They're not very powerful, and they're often not very smart in terms of overplaying their hand, but they're very cunning, and they're standardless and shameless, and so they will do things that people of conscience can't imagine. People of conscience cannot imagine the depravity of predators. And so it puts us at a disadvantage until we take off the rose-colored glasses and realize that human nature is imperfect. It always was, it always will be. There will always be a small number of human predators. And we will always have to rein them in, or else we will face societies that can be transformed into weapons of mass destruction, like what happened in the Holocaust, or what happened in Bosnia-Herzegovina, or Rwanda, or the Congo today. It's a formula. It always works the same way, using mass media.
Man, that's
Very
crazy.
dangerous.
That is dangerous. So, real quick, for when the fall does come, like what can families do to help prevent catching COVID-19?
Great question. And I would suggest that everyone listening do this now. It's urgent, urgent, urgent. If you have, first of all, if you live in a fairly modern home, you may have humidity functions on your HVAC, and you just have to turn the dial to around 55%, set it and forget it. Leave it there 24/7. And nighttime is the most important because we lose water when we're breathing. You know, when you get on the scale in the morning and you think, oh, I've been dieting and I've done a great job because you're lighter, and that's just because you lost water. And that's so the mucus can dry out at night unless the humidity is in a green area, which is 50 to 60%, ideally around 55% round the clock. So if you don't have that and you have a house with lots of living spaces, then you will want to look into what's called a central humidifier or steam humidifier, which your air conditioning company can put onto your system, and they're relatively inexpensive. And then again, you just set it and forget it. And the same thing if you have a business like a restaurant, or you can do that if you have your own HVAC system. If you live in an apartment or a small home and you don't have a lot of space to cover, you can go out and buy a humidifier and a hygrometer. And it's spelled H-Y-G as in golf, hygrometer, not hydrometer, hygrometer. You can get them between about $8 and $15 online. And that will make invisible danger visible and enable you to make that invisible danger safe by simply adding water to the air you breathe indoors until indoor humidity is between 50 and 60%. That's a plan I call Humidity Saves Lives. So that's all you do, is you just humidify 24/7, or at least keep it in that range 24/7. Sometimes you won't need the humidifiers on because as the weather changes outdoors with the barometric pressure and the dew point changing, we don't know it, it's invisible. It will change the humidity indoors. but as long as you're in that range, you're in a safe area. So the next step is, if you have any influence on leaders in your town, in your company, in your business, in your office, get them to turn up the HVAC humidity to about 55%, or if they can tune it in based upon absolute humidity, it should be around 11 grams per meter cubed, 11 and a half. That's perfect. And that's it.
That's it.
It's simple. It's a no-brainer. So all you're doing is making your indoor air safe, like Taiwan and Hong Kong and Thailand and Haiti and Japan and all these places that have essentially not had COVID.
I love it. This has been such an educational conversation for me, at least. I love.
I'm sorry. They have had some COVID, small numbers, but really small. I mean, if you have a nation of 24 million people and you've had 7 deaths, that's essentially not having COVID in terms of the outbreak.
Yeah. Well, I'm, ending this conversation. I kind of have an idea, but what do you want your legacy to be?
Oh my gosh. So I want people to realize that America is an amazing place because it was founded on principles of humanness, of a human scale. So America is based on this notion that we are imperfect and that we need checks and balances, and that every generation has a job to do to rein in the dark side of human nature and allow the bright side to flourish. And so when we see ourselves as imperfect, America is a pretty darn good place. And I don't say this politically, it's not right or left, it's from my experience in walking the ground where millions and millions and millions of people have been murdered in modern times. I don't know anyone else. I've not even heard of anyone else who has been to more places than I have in the last 25 years, where so many millions of people have died. Prior to the current Smithsonian exhibit, the Smithsonian Air and Space Museum centered their commemoration of the 100-year anniversary of World War I around my discoveries and photographs with an 18-month exhibit. And in World War I, we had 10 million people, soldiers that died, and many, many millions more civilians. In the Holocaust, millions and millions of people. And so my legacy is to try and help modern societies realize that trust in each other is the glue that gets us through, like what we saw at the beginning of COVID, where tens of thousands of healthcare workers and frontline people put their lives on the line every single day without question, afraid, and I was one of them, still am. And we went to work, and there was no black, white, gay, straight, rich, poor, educated or uneducated. It was an outpouring of altruism based upon being human. One human being helping another, complete strangers risking their lives to save the lives of complete strangers. That's the legacy that I want to inspire. And I want to help us get through COVID quickly, because that will help prevent anarchy and the end of this amazing country that we have now. And I want people to relook at race. So my current exhibit at the Smithsonian, which is up through September 6th, it's actually, I'm part of an exhibit. It's not my exhibit, but it's a large exhibit. And I discovered a secret hidden for 100 years that changes the way we see race in America and the way we see ourselves. and there's an unknown narrative about race that unites the country around race. And so that's what I'm aiming to help Americans reconnect to what's human and what's real, and to stay connected to their human core.
That's beautiful. Where can I, or where can some of the audience find some of your work besides the Smithsonian?
Is my website. It's kind of, I haven't updated it in a long time, but there's a photograph a day on World War I, on the collection that I've photographed, that you can see on there, or on Facebook, or on Twitter or Instagram. And then on LinkedIn, if you go to Jeff Gusky, the interviews, podcast interviews that I'm doing can be seen. And so you can get a good sense about the story on race, and also this evolving story on COVID and preventing small viral outbreaks from becoming massive viral bombs. And I just want to leave people with this hopeful thought that if we can just get one governor to issue an executive order, and within a few weeks the hotspots go away, then every state will follow that, and every country will follow the United States, and we can rein in this plague on our lives and get our lives back.
Doc, I want to say thank you for taking the time. Thank you for coming on the show. This has really been inspirational.
Thank you. Thank you very much. It's an honor.
Again, I want to say thank you to Dr. Jeff Gusky for coming on the show and helping us spread the message about humidity and its relationship to COVID-19. And I want to say thank you to the listener. Thank you for hanging out. Thank you for downloading this episode. Thank you for taking the time to listen. Please share this message. Please let me know your thoughts. Please leave a rating and a review wherever you get your podcasts from. It helps me scale the show. It helps me get this out to those who may need it the most. And until we speak again, I hope you guys have a great week. Later.